guys, if you ever are scared to get an IV or don't know, like, say what to do if you do, so, yeah, here you go. I just filmed this 4 times, so, yeah. So first, you are going to, once you have any type of hand sanitizer or anything like that, this is our tourniquet to make your veins pop out. You're going to need alcohol pads. You're going to need you're going to need a syringe, a needle, and you're going to need some sort of Band-Aid. So yeah, hand sanitize. Now you're going to take the numbing cream off. There's lots of different types of numbing, needle, cream. This is just what I'm doing. So you're going to obviously take the needle and you're going to pop it in. After you wipe the surface, make sure all that debris is out. You're going to pull the needle out, and this is not an IV needle. Normally there would be a cannula around it. This is about the size of the needle that is inside the cannula. Only a tiny little inch or centimeter pops out of it. So you will want to obviously have the cannula. You're going to pop, make sure the vein is good, and make sure the patient is comfortable. You want the patient to, if they want music playing, they can have music playing. If they want you to hold their hand, if they want someone to hold their hand, if they want a parent to hold their hand, let them. And if you look at the needle, you can see how there's an angle on it. You want that angle going straight. You don't want it upside down. So when you inject it, you want to squeeze almost a little bit, and then when you get through the layer, you don't want to go straight down, because going straight down is not going to go on the vein. So go at almost an angle. So down in and through. As you can see, no pain. You're going to then tape it down, and sometimes they'll do shields on it. I know, shield. I just did that taping wrong. If they want more tape, less tape, if they're allergic to latex or different types of tape, make sure to listen to your patient. Do not say like, oh, they're fine, because the patient's comfort is number 1. They're at the ER for a reason, and no one wants to be there. So, yeah, you're going to then check for blood return. Okay, there's blood return, and then you're going to push it back in and remove that blood return. So, because normally you're going to get blood work done. If you're at the ER, you make sure your vials look good, and then if you are going to get a medication for say, you always need to wipe it down, and then you'll suck it up, and then you will inject it back in. When doing this, obviously make sure it is safe. If the patient is uncomfortable, ask them why, and please be a listener. Don't be that doctor that does not listen, or nurse. And then, okay, I'm picking something up with my toes. Make sure they listen, and if a patient is uncomfortable or might need an IV change, please listen to them. This is not medical advice, so yeah. You're going to, oh my gosh, okay, hold please. Oh, get back. Okay, sometimes they will put like a shield on it. I'm trying to get this unscrewed. Okay, unscrewed now. So that's what it'll normally look like. And there might be some blood that comes out. Totally okay. So I have a IV bag here. You're going to want to take the IV bag, okay? And you're going to need a hook of some sort. My hook is no longer a hook now. So you want to make sure you have a hook of some sort holding it up. So here, I'm gonna go over. Me and the patient are gonna go over here so I can show you guys better. As you can see, the door Give me 2 seconds. And if you go to ER, you are going to be getting an IV. It's almost, I can be more certain about that, you're getting an IV. So, no matter the reason, it's because they need to be able to run tests, they need to be able to deliver medications, and so on and so forth. So, yeah. So, there's the IV bag. You're going to then take the IV bag. You're going to want to hook it up, and then you are going to want to hook it up to the patient. At this time, you are now going to remove the tourniquet. The tourniquet should have been removed earlier. That's my bad. So you're going to have the thing there. You're going to then have the connector. And then they're going to be connected to the IV fluids. Or different things, and then you are going to remove the cannula. When removing the cannula, you do need to be very safe, and the patient's probably going to be scared, so you're going to take the tape off and remove quickly. I did not have the bandage open. And then you're just going to flop it over. This is not medical advice, and this is probably not the most accurate that it could be, but I hope this helped, and I love you guys. Like, subscribe.